What's going on, everyone? A lot of people have been coming in saying the same thing, that every morning they wake up, their pains increase in the morning, their stiffness is a lot more during the morning, getting out of bed, but then as they get up and start to move around, that they notice it starts to get better, maybe after they take a shower. And it makes sense from an anatomical standpoint. So all day, every day, we are facing axial compression from gravitational forces. So your spine's kind of like an osmotic system, and it responds with pressure. And so a lot of times throughout the day, your discs have a lot of pressure on them from gravity, and they lose their nutrition, if you will. You know, a lot of people talk about the jelly donut analogy. Well, you know, by the end of the day, you're a couple millimeters shorter than you are at the beginning of the day, and that's because of that lost nutrition. So what happens is when you lay down at night, your body reabsorbs a lot of that lost energy, a lot of that lost nutrition. So technically in the morning, you're kind of like a very absorbent sponge, and the discs in between each bone have kind of absorbed a lot of that lost nutrition. So it's not uncommon to feel more swollen in the morning. So I wanted to go over a couple strategies on what you can do to kind of minimize that effect of getting out of bed. So first thing you're gonna do when the alarm goes off is you're just going to lay on your back, and we're gonna do each leg here. You're gonna cross one leg over. So commonly we'll be doing pigeon stretches or the pure performance stretches out in the gym. This is something that you can do from bed too. So my rules for this is to follow the tension. It's gonna be different for each person. So what I like to do is test and just pull the knee towards the same side shoulder and see how that feels. And then I'll test and I'll go more towards the midline, and you're gonna be feeling this through the buttocks here. And you can also manipulate the leg angle to really see where do you feel the most tension. Now, if I go directly across to my left shoulder, it's tight, but it feels more because the joint's locked up compared to the muscle. So try and go more midline and then just mess with the angle of the leg. And I'm gonna have you hold that for about 30 seconds or so, and then you can come off of that and relax, and then you can go back for another set. Now, if mobility is an issue, you can grab a belt or a towel to help assist with that pull. So about 2 sets of 30 seconds on the right leg, then go to the left leg. This might be a completely different positioning for your leg. It's totally fine. Follow the tension once again and see where do you feel that most pull in that hip, and hold that there for 30 seconds. Come off of it and then do another set of 30. From there, what you're gonna do is you're gonna rotate onto your stomach, and we're gonna get into what we call the prone press up, okay? Now, the important thing is that this is not the cobra pose from yoga. This is not an exercise for your chest or your triceps. This is for your lower back. So the important thing is to keep your belly button on the table. And you're just going to extend up. And we're gonna do about 15 of those. And it's not uncommon, especially first thing in the morning, to have a little bit more pinching or catching during. It's okay as long as after you have finished and you've rested for about 10 to 15 seconds, it's kind of gone back to your baseline. So assess your pain level on a scale of 0 to 10 before you start, and where do you feel that pain? And then after your 15th repetition, and after resting for about 20 seconds in this position here, make sure it gets back to that baseline number. If it starts to increase more or starts to feel it kind of travel away from that original spot, then this is probably not the best exercise for you, and you should probably contact one of us or your physical therapist or your primary care to see what else could possibly be going on. But taking in those strategies to account, you know, a lot of times first thing in the morning, you're gonna naturally be more stiff. Doing these every day, every morning upon waking up for about 5 minutes, you can really help decrease that stiffness, so try it out.